Gracilis sartorius and tensor fasciolata. Oh, I didn't talk about the lateral, did I? Tensor fasciolata, we talked a lot about that the other day. So it's a little piece of muscle with a whole lot of tendon. Okay. Okay. Other muscles, gracilis sartorius. So gracilis is one of your adductors, actually. But it actually starts up in the pelvis and it does cross, because you remember we talked about that pes ins ring, and so gracilis actually comes down and is part of that. So it does cross the knee as well. Sartorius starts at the ASIS, crosses over, and comes down. And so it's responsible. It's not a prime mover for anything, but it's a role player in being able to do this. Okay. Huh?
External rotation.
Well, flexion, external rotation, a little bit of abduction, knee flexion. It plays a big role. If I get, they're gonna make me get my toys out.
For sartorius.
So I don't know if you can see this, but sartorius comes from here and it comes around. So when it tightens up, it's going to do this.
Gotcha.
Can you see that? How many old these? All right. Okay. So all of these things span the knee posteriorly, provide stability at the knee. These do not have a prime mover function. Okay, basically because of size and angle of pull. Okay. Tensor fasciolata, one of the biggest things about that is at the knee it provides lateral stability. If the tensor fasciolata isn't working properly, it's hard to stabilize that knee in extension to stand on it. Gracilis and sartorius, because of where they are, provide some medial stability. Gastrocnemius comes up from below, hamstrings come from above, but they're not really lateral and medial, but because they kind of wrap around the knee a little bit in their attachments, they provide some lateral stability. Does that make sense? And then the quadriceps, huh?
I hear a train. The phone.
Oh. And then the quadriceps become the anterior stabilizer. We've talked about this before, the pes ins ring, which is the goose's foot. So that's made up of sartorius, gracilis, and semitendinosus. They all arise from the pelvis. They all initiate from the pelvis. They all cross the knee and the hip, and they join together in the anterior medial surface of the proximal tibia. And surgeons sometimes alter this to add stability to the knee. So again, that's that tender spot that you feel right there, so that tells you that you probably don't stretch it enough. Yeah, it does. It's generally tender on most everybody. You're a little too anterior. Go. There you go.
Does it matter?
No.
You're so tough. It hurts me.
And this is just the picture of that.
Medial side. It hurts my left side around there.
That's your ITV. Okay. Any other questions on the knee? How do you stretch that?
Yeah.
Well, a lot of those muscles are adductors, and so you would just stretch your adductors.
Like this.